Health has improved significantly, particularly in our region, but yet deep inequities and inequalities remain. The health challenges that you can see on the slide have become multifaceted, and they require the active involvement of all levels of government, both internationally, nationally, and also locally. In spite of these great improvements in the European region, and let me emphasize once again that when I say great improvement, what I mean is that we gained 5 years in life expectancy over a period of 30 years, which is a tremendous success in the European region. But our region is scarred with inequities in health. It is not only inequities between the countries that worry us, but there are also inequities within the countries. Even in the most developed countries of our region, you can find 9–10 years difference in life expectancy, and that is huge.
One of the new things that we've emphasized in this review that I had not emphasized to anything like the same extent in previous efforts was the whole importance of intergenerational equity. What happens to the parents impacts on the children. Investing in early childhood, you get improved child development, cognitive and linguistic development, social and emotional, as well as physical development. You don't have to be a rich country to reduce child poverty. You have to make a decision that you want to have low child poverty rates and use the tax and transfer system to achieve that, as Slovenia and Sweden have done, and Norway.
It's childhood in general, and I think we would say early years in particular, that develop the capacities that people go on and have, and the dispositions that they go on and have that then impact on their behaviours and the choices they make, but that also open up or close down the life chances that young people go on and have, which themselves have an impact on health outcomes.
An investment in social protection policies is likely to improve health and reduce health inequalities. And we also claim that this applies actually to all the countries across the whole European region, although in different ways.
So not a single country in Europe can relax and say, job done. We've got this huge health divide across the region, and within countries of the region, all of us, from the very best in terms of life expectancy to those with the lowest, have this problem of large social gradients in health, and in many cases that social gradient is increasing in magnitude. Universal access to high quality health care is of course vital across the region.
It's not people that are vulnerable, it's the social spaces that they are forced to inhabit that are vulnerable. And we have to change those social spaces. And the reason we talk about social spaces rather than places is because some groups carry these vulnerable social spaces around with them. So the Roma are vulnerable wherever they are.
Our recommendations were grouped into 4 groups: life course stages, the wider society, the macro level context, and systems, health and social systems.
Our cry is, if you're in a poor country, doing very little, do something. If you're in a country that's doing more to address social determinants of health, do more. And if you're up there in the Nordic countries and you're doing a great deal, do it better. We can all make a difference.